I think the patients enjoy and appreciate the ability to see someone outside of institution. This is not a big intimidating place like a hospital. More personable. They see a doctor every time they come into the office. They get to know us, we get to know them, we know their families. We kind of grow with them throughout their health career and our professional careers. We are able to see patients fresh from an injury, do diagnostic testing, x-rays we have here, MRI we have here. We have a surgery center here where we can do full service orthopedic care, and we have physical therapy here for post-operative care. So a patient's going to essentially come in with an injury, be evaluated, be treated in the office, if necessary have a surgical procedure, have therapy here afterwards, and go through the entire experience of their care under one roof. So it's a big convenience factor for people. It certainly helps keep costs down, and it's outside a hospital institution.
It's very rewarding to be an employee of a company that cares to not only provide great service to their patients, but also to provide that extra input into the community. Patients are being able to be seen definitely within a day, and sometimes the same day.
We've had a presence in Green Bay for the past 50 years, hopefully 50 more years to come as an independent practice. We have doctors that are involved in all facets of the life of Green Bay, from grade school to college. We're involved in civic things in Green Bay. I think we're all very intertwined in the community, and I think that's part of our job, is to be part of the community.
Everything is in one location. You have the doctor's office, you have physical therapy, you have the surgery center. So it's one stop, and they can get everything done and taken care of.
It was a physical pain to walk into work. It was a physical pain to walk anywhere. I remember walking with my husband one night, and literally I was in tears by the time I got home, and I just looked at him and I said, "You don't understand what I'm going through right now." I had some shots in my knees because my son was getting married, so that got me through the wedding. Doctors seem to know when you are done, it's time to go. Let's rock and roll and get you back on the right track. I had double knee surgery, one in January, one done in April, and it was 6 weeks after I had my first knee done, I had my second knee done, and by summer I was back to being able to walk and enjoy the summer. Just getting one knee, it was like, oh my goodness, this is fantastic. To get the second one done, it's like, I can do anything.
When patients come in to use our acute injury clinic, it usually is for something that just happened. If patients are injured at work, they can be sent right over to our clinic to be seen, and usually within a half an hour. And then if they need other services, if they need the MRI, we can offer that the same day. There have been cases where they've needed surgery, and they can have that done too the same day.
We've had patients come in that were in a wheelchair, and then they met the doctor, they had their labs, they got a diagnosis, got treated with their medicines, and now they're walking. So, it's good to see that. Usually the first appointments are where they evaluate what your symptoms are. They look at the entire picture, get previous records from other physicians, and then they do an exam and then order labs and possibly x-rays, which is a nice part of our rheumatology department because we can do our labs here, we can do x-rays right on the spot. If they're getting IV therapy, they're getting it every 4 weeks, every 6 weeks, 8 weeks. So it's kind of an ongoing thing. It's not necessarily a treatment of one and done. We're going to keep an eye on you and do whatever we need to do. I think the end result of having a close-knit team is that the patients feel more comfortable. The patients know us, and they know that they're going to be treated well.
We do deal with workman's compensation or workers' injuries. It doesn't matter whether you're on the athletic field or in the paper mill, injuries happen, and we take all comers and we treat the athletes like we treat the workers and treat the workers like we treat the athletes. The goal's the same, to get them back to their job or their sport as quickly and as effectively as possible. And we've got a fantastic staff here that will help the patients work through the issues of workman's compensation, time off of work, disability. They take the ball and run with that to help make the non-medical things much easier to get through.
Everyone that I have met here is professional. They take care of you. They put you at ease from the moment you walk in until the moment they say, "Bye, I hope we don't ever see you again in here." It's that kind of atmosphere that makes you say, that's where I'm gonna go, because they do put you at ease from the moment you walk in until the moment you leave. You don't know what it's like to have aches and pains that just don't go away. And when you get an artificial joint, all of a sudden you have that mobility back. I'm almost getting tears in my eyes. It is like a new life. It just makes you say, hey, there's more to it than, walking around taking Advil every 4 hours. I'm back to 95% of what I could do before. I don't run anymore, but I do walk. And at my age, I have grandchildren. The only time you have to run after them is if they're doing something they're not supposed to be doing. And it's led me back to a wonderful life.
I like the benefits of private practice. I like the benefits of an independent practice. I like the ability to formulate our own destiny and put our actions into work and see the fruitions of that.
What makes me most proud to work here is the fact that everybody works together, that we're all an asset, we're all a good part of the team.
I never thought I'd be somewhere for 10 years. I'm kind of surprised to find myself still here. The clinic is just a great place to work. I love the patients that come in. I enjoy working with all my coworkers. Everyone's so nice and friendly. It is like a family here. Our doctors can actually change lives. They can help people with their joint replacements, with their sports injuries, with their work injuries, and they can improve patients' lives with the results of their surgeries and of their care.
The company as a whole is just a wonderful place, and I can't see myself anywhere else.
I would just like to thank all the nurses and the staff and the doctors that work here, because there's a lot of people that count on you, and you are doing an excellent job.